Ever been blindsided by a patient asking why physio over chiropractic? It's like a pop quiz that tests your entire career. I've been there, scrambling for the right words to show why physiotherapy shines. Today we're tackling this part of my Unsolved Challenges playlist, diving into tough questions like pain versus function, and today, the physio versus chiro debate. We'll explore why chiropractic care gets criticized, why physios win by empowering patients with active evidence-based treatments, and talk a little bit about the role of hands-on techniques. Plus, stay to the end for a bonus section. What's it going to be on? I don't know. It's a surprise. Let's wait and see. And when I say physio wins, I mean we empower patients with the skills for lasting recovery, moving beyond quick fixes. Let's get started. Section 1, the dark side of chiropractic care, why critics are calling foul. Chiropractic care often catches flack for focusing heavily on spinal adjustments and passive treatments. I see this all over YouTube with these crazy cracking videos. I know some patients love this short-term relief, coming back regularly without addressing the root cause. It's like a subscription service, a convenient moneymaker, but not always the best care model. Some chiropractors claim adjustments help with other things like asthma or immunity, but these promises lack solid scientific backing. It's like how smoking was once called healthy. Then there's the concern about neck manipulations. Although rare, neck manipulations have serious risk of damaging blood vessels, potentially leading to clots and strokes and permanent disability. Personally, I'd never let anyone manipulate my neck. And that's precisely why caution is so critical. These risks, while uncommon, are a critical factor when comparing approaches. Even within physio, there's debate about how much to rely on hands-on techniques. Some argue that methods like massage and mobilization are more like spa services than active treatments. And in some cases, they might be right. The best physio approach emphasizes active, evidence-based methods like exercise and education. That's precisely why I'm making these videos, to push the profession in the right direction. Section 2, why physio wins. Active participation and education for lasting results. Physiotherapy and chiropractic care are two distinct approaches to musculoskeletal health. While both professions aim to help patients, they differ significantly in their foundational principles, treatment approaches, and integration with the broader healthcare system. Physiotherapy takes an evidence-based approach to rehab and health, and at its core, physio empowers patients through active treatments, guiding individuals to take charge of their own recovery and reduce dependency on care. By emphasizing active exercises, movement retraining, and patient self-management strategies, patients are encouraged to manage their conditions independently. Patients get better between visits with their home exercises. Home exercises, we keep saying that. Physiotherapists work to restore confidence and help people return to active activities and improve function. Physios help patients overcome their fear of movement. This evidence-based approach ensures that physiotherapy operates within the mainstream medical paradigm, making it less likely to make bold, wild claims about health promises and unscientific stuff. Physiotherapists work in diverse settings like hospitals, rehab centers, nursing homes, outpatient clinics, home care. This diversity allows us to treat a wide range of conditions like orthopedic conditions, neurological issues, cardiorespiratory, sports-related problems. In contrast, chiropractic care has a narrow scope of practice, focusing primarily on spinal manipulative therapy for musculoskeletal problems. While manual therapy can provide short-term benefits for some patients with low back pain, particularly when used alongside with active treatments, critics highlight that there's a lack of robust evidence for the chiropractic efficacy beyond back pain. Chiropractic care may offer a feel-good technique on an ongoing basis, whereas physio emphasizes a long-term active recovery and empowerment, aiming to discharge patients to a home program where they can improve their own function. Section 3, the role of hands-on techniques within physiotherapy, why active treatments win. Manual therapy has its place, let's not forget that. But the real transformation happens when patients participate in their own recovery. Sure, some clinicians rely heavily on hands-on techniques, but the best driver of long-term recovery is active exercises. Active treatments are the cornerstone of effective physiotherapy. Passive treatments like joint mobilization, soft tissue works, hot packs, electrical stimulation, they are often used as a soothing symptom relief interventions. They can provide temporary relief and address some symptoms. These passive interventions, they do have their place, and they can serve to support those active exercise treatments, helping to reduce pain or stiffness or increase tissue pliability. For example, applying heat to promote relaxation of tissues, and then doing your manual therapy and stretching. Soft tissue work can be helpful with short-term pain relief, maybe some increased mobility, but there are no long-term benefits besides the placebo effect. I know some people love their soft tissue work, so if you like your foam roller, keep using your foam roller. The fundamental principle of physiotherapy is patient empowerment through active treatment. This means that patients actively participate in their recovery through exercise, movement retraining, and self-management strategies. Active exercises are more effective than passive treatments in creating lasting change, reducing that fear of movement, and educating patients on improving function and ultimately encouraging self-efficacy. Patients get better between visits by doing their home exercises. I think I just said that. Physiotherapists focus on exercises that restore function. This includes improving the ability to perform activities of daily living, returning to work, hobbies, and sports. This approach aims to build strength, flexibility, and confidence that directly translate to real-life situations. Over-relying on passive treatments can slow down this recovery and foster dependence on the clinician, leading to patients losing confidence in their ability to manage their own condition independently. This contrasts with the goal of physiotherapy, which is to reduce dependency and increase patient empowerment and self-management. Some sources raise concerns about passive treatments not addressing the underlying problem, grinding through the patient's insurance money, that creates a cash cow for clinics, and that's ethically questionable. So a balanced physio approach prioritizes active, pain-free exercises and patient education to empower individuals and drive long-term functional recovery. Manual therapy and passive modalities can support acute symptom relief, but they're not the drivers of lasting change. The real magic lies in coaching patients to their own health and actively participate in their journey towards lasting independence. And wow, look at you, you've made it to the bonus section. Well done. The bonus section, Becoming a Better Physio, how to answer that physio versus chiro with confidence. To answer this physio versus chiro question with confidence, we as physios need to focus on our core role to empower patients. This approach addresses the unsolved challenges within the profession regarding optimal care and patient outcomes. I'm making these videos specifically to push our profession in a better direction, to share what I've learned. Physiotherapy's strength lies in its evidence-based practice and active treatment approach. Patients get better between visits by doing their home exercises. What is that, the third time I've said that? Home programs must be designed to restore function and enable patients to return to their daily activities, their work, their hobbies, their sports, or whatever. Patient education is crucial, aiming to decrease fear and foster independence. We help patients understand that pain doesn't always equal harm. We show them how to participate in their recovery of function. A strong therapeutic alliance is essential. We need rapport, communication, and active listening. Therapists must be present and genuine and clear in their approach. That is my simplified physio approach right here. Patients need to buy into their therapy, which is achieved by setting clear, realistic, individualized goals that align with their needs and aspirations. For patients with chronic pain, fear of movement is a common challenge. Physiotherapists can address this by using exposure therapy, gradually reintroducing movements or activities in a safe environment, helping patients regain confidence and function. So physiotherapy focuses on helping patients recover and become independent in the long term. We do this by teaching patients exercises and educating them on how to move better. Manual therapy and other passive treatments can be helpful, but the real key to success is empowering patients to take charge of their own recovery. So when a patient asks, physio or chiro, we can confidently recommend physiotherapy. It's evidence-based, it's a whole-body approach, it's focused mostly on active exercises and patient education. With select use of manual therapy or other passive treatments, we empower patients to take charge of their own functional recovery. Research shows that active treatments lead to better long-term results. Passive approaches might be providing some temporary relief, and they often don't lead to lasting recovery. By empowering patients to take charge of their own care, we can help them achieve real progress and reduce their need for ongoing treatment. As physiotherapists, our approach is based on science and focused on what patients need. Let's keep sharing our expertise and promoting the value of physiotherapy in healthcare. How do you handle that physio versus chiro question in your practice? Share your experiences and insights in the comments below. See you in the next video. My 2 books are now available at Amazon. What they don't teach you about documentation in physiotherapy school, a short how-to manual for successful daily note templates, and From Injury to Recovery Through Exercise, simple functional exercise progressions for physiotherapists to restore lifting, standing, walking. Thank you for your support. Get ready for more sparkle, this video right here, and let that subscribe button be your gateway to a world of endless possibilities. Thank you.